Makakapanayam natin ngayong gabi ang Special Advisor ng National Task Force Against COVID-19 na si Doc Ted Herbosa.
Doc, good evening po sa inyo. Salamat sa inyong oras. Welcome sa Frontline tonight.
Good evening, Mayan, and good evening, Ed, and good evening to all the televiewers ng Frontline.
Yes, sir. Thank you for joining us tonight. Sir, siyempre, we're talking about yung concerns na nilabas na ng WHO mismo. I'd like to ask, is it premature to ask how bad it could be pag may dumating ang surge come election time or post-election time?
Well, of course, these are prediction models. No, our statisticians, even at UP, our statisticians are predicting also an uptick, and it's the same message. They're saying it's because of the waning efficacy of the vaccines. We have about 66 million Filipinos with 2 doses, and over a period of time, that immunity can wane or weaken, and that's why we saw in other countries also a peaking of cases after some time. So it's very important talaga to have a booster dose, the booster shot, especially those that haven't gotten their booster shots.
Doc, may mga nakita na pong kaunting uptick o yung pagtaas po ng kaso sa may bandang NCR at Mindanao. Ayaw naman natin manakot, pero indikasyon ba yan na posibleng nag-uumpisa na po yung sinasabing surge a few weeks from now or sabi nga 2 months from now?
Yeah, we're watching also yung tinatawag naming test positivity rates, which we're at the low 2.1% of all those tested, and there seems to be some amount of increase to maliit lang naman, 3, maybe not significant. We won't know until we see the 7-day average. So we're now comparing weekly averages, di ba? Yung last week's average compared to this week's average before we can make any conclusions if there's an uptick or not.
Sundot lang ako ng isa, Doc. Kanina sinabi nyo kasi mahalaga na magpa-booster shot, no? Pero galing tayo sa surge because of Omicron. How do you deal with that notion na yung mga tao parang hindi naman sila talaga, yung iba ho, hindi masyadong takot dun sa Omicron anyway, mild lang naman at hindi nakakamatay. Kaya siguro walang walang desire for booster shots.
That's our problem. Many said as long as they got 2 shots, they're okay. But unfortunately, when you saw the numbers of Omicron cases, no, that we were having peaks of 39,000. If you look at South Korea, in their peak, they were having 600,000 in a day. So even if you say it's mild, a certain percentage of those will be serious and will be hospitalized. So when you look at the magnitude and you project that, if they're very infectious, like this coming Omicron XE and the other recombinant variants, sub-variants, they're 10 times more infectious than Omicron. So can you imagine more people getting infected? So it's really important to get that booster shot if you haven't gotten that booster shot.
Yes, sir. But the numbers don't seem to cooperate with us. Well, not the numbers, but the people don't seem to cooperate with us. Kasi the numbers say, what, 11 million or 11 plus million pa lang?
12.1 is our latest number of boosters.
At least may improvement.
And there should be about 33 to 40 million already with booster shots. Because we are about 66 million with 2 doses. So where are they? So why are they not asking for their booster shots? And we've tried to make it very easy. We put it in the LRT, MRT stations. We put it in the boutiques. We've gone around, and the president has even ordered us to go house to house to be able to really give this booster shot. So it's very important. People understand. Yes, we're in a good place today, but as WHO said, and was all your other statisticians are saying, there's a possibility we'll be having an uptick in April or May.
Sir, well, ganito po kasi, we cannot avoid Holy Week, we cannot avoid Ramadan, we cannot avoid the elections. What would you suggest that people do or people keep in mind to avoid COVID-19?
Number 1, we are still in a pandemic. We have not declared the pandemic over. So reminder, very important to get that booster shot. Very important to get fully vaccinated if you still haven't gotten your 2 doses. And when we travel, let's wear the mask, no? When you're in busy airports or busy bus stations, terminals, make sure you wear a mask. If you're riding the plane, if it's only a 1-hour flight, 30-minute flight, wag na kayong kumain. Because if you eat, you'll remove the mask. You'll put yourself at risk. And then when you're in your travel destinations, we are suggesting you stay in your bubble. If you're with your family, at least you know the status of your family. They're all negative and they've been vaccinated or even boosted. Stay within that group para hindi kayo magkaroon ng added risk by going with other places. And then for the people campaigning, no, make sure you wear your mask when you go. I'm not advising senior citizens to go because you're the ones at risk to be hospitalized. And if you're in a campaign rally and you see the one beside you with this mask in his chin or shouting out loud, I think you should stay 1 meter away from that guy. So use the physical distancing that the DOH is recommending. So we already know what to do. The important thing is we behave. We behave and think like we know how to fight COVID-19.
Yes, sir. Sir, last na, sir, I suppose ang talagang malinaw na kalaban dito is complacency. Yung pagkakampante ng taong bayan. Lalo't parang nalusutan natin eh. ano pang kailangan mong iwasan, di ba? So, how do you fight that? I mean, di ba? In the end, it boils down to that eh. How do
It's
you
a reminder, no?
convince
I'm a
Filipinos?
doctor and all the time I remind people, if you're diabetic, not to eat sugar. If you're a smoker, I tell you to stop smoking. In the end, it's behavioral change, no?
Yeah.
That's the hardest part in medical practice. That's the hardest part, making your patients really follow what you're saying. And we sound like broken records every time you see us to keep telling you to do this, to do that. And we'll continue to do that with the help of you in media, to tell the people, continue this, it's not yet over. Beware, WHO is warning us, the statisticians are warning us, get that booster shot, wear your mask all the time, wear it properly, and observe distancing.
Doc Ted, akin short lang. Tama po yung sinabi ninyo na reminder about masks kasi nagko-cover tayo book ng mga sorties no, sa iba't ibang lugar sa Pilipinas. Talagang napapansin ko po, Doc, ang dami na pong hindi nagmamask or talagang may mask pero nagtatanggal pero tabi-tabi yung mga tao.
Correct.
So
And especially in these political rallies, they are shouting. So when you shout, it's aerosolizing, it really spreads. If they have the virus, if they're an asymptomatic carrier, they can really spread it. Even if that's open air, that really also puts you into risk. So I wouldn't even bring my elderly relatives in those rallies because they're really, high-risk events or super spreader events. Diyan siguro mangyayari. Remember what happened in South Korea? South Korea just had an election a month ago, and they were, they suffered from it. So was Delta. Delta came from India during a campaign period as well. So I hope we'll not be in that list because we're having a campaign period as well.
India,
So
sabay
let's all
ang
be
campaign
careful
period
and
sa religious
behave.
festival.
parang
Yes,
tayo
and
din.
religious festival, which is our Holy Week and Ramadan. So we're having those two as well. So all the three, talagang anong tawag mo doon? Perfect storm.
Confluence of events.
Yes, and perfect storm, di ba? The perfect storm when all the events are there. So everyone, be careful. Have a good Holy Week. Support your candidates, but follow the minimum public health standards. And most important, get boosted. Get that booster shot, please.
Yon. Alright. Maraming salamat po sa inyo, Dr. Ted Herbosa, ang Special Advisor ng National Task Force Against COVID-19.